Hi, I'm Jacqueline Eckern, and I'm the president and founder of Eating Disorder Hope. And we want to welcome you to the Eating Disorder Hope online inaugural conference. We are thrilled to have Dr. Kate Craigen with us today from Walden Behavioral Care. She is the clinical director of the binge eating and bariatric support services at Walden. And she's responsible for clinical development and implementation of the binge eating disorder program across all of Walden's levels of care: inpatient, residential, partial hospitalization, IOP, and outpatient. And Dr. Craigen collaborates with various bariatric providers and partners throughout New England, and this helps ensure both pre- and post-bariatric surgery patients gain the proper behavioral skills to enhance long-term outcomes. Dr. Craigen received her doctorate in clinical psychology from Fairleigh Dickinson University. Welcome, Dr. Craigen.
Thanks so much, Jacqueline. So I'm excited to be here and talk a little bit about binge eating disorder. For this presentation, we're going to go through what is binge eating disorder, how do we define it. We're going to talk a little bit about who's impacted by the disorder, some of the most common treatments, and then I'm going to make a recommendation about a few resources that I think are very helpful. So in our diagnostic manual, that's the DSM, binge eating disorder is defined by recurrent episodes of binge eating. And the way that we define this is an episode of binge eating is defined as eating in a discrete period of time some amount of food that is larger than what most people would eat in that similar period. So really this is about, while no two personal accounts are exactly the same, the amount eaten is definitely larger than what most people would eat, though this is pretty hard to define, and admittedly the size requirement of a binge eating episode is somewhat contentious. I think the really important part of the definition is actually the next part, which is that there is a sense of loss of control while eating. So people will describe that they are not able to stop eating once they have started. Sometimes the loss of control begins when people are shopping for the food or pursuing the food, looking into the refrigerator to see what is there. That this loss of control feeling, people sometimes have awareness during the eating episode that they would like to stop, or that they don't even like the food that they're consuming, and they are not able to interrupt that behavior. So these episodes are typically associated with 3 or more of these following features: eating very, very quickly, more rapidly than normal, eating until you feel uncomfortably or physically full, or really like there can be pain or discomfort. The eating episode typically is not associated with hunger, and oftentimes people will end up eating alone due to embarrassment or shame about the eating behaviors. And often following the eating episode, there can be feelings of disgust, guilt, depression, or shame. Most often people have significant distress regarding this type of eating behavior. We know with regard to frequency that a binge eating disorder diagnosis is accompanied with this behavior occurring at least once a week for the past 3 months. And people who meet diagnostic criteria for this particular disorder wouldn't also be engaging in laxative or diuretic use, and they wouldn't meet criteria for other eating disorder diagnoses like anorexia or bulimia. So a few other common features I just want to specify that are related to binge eating episodes is this feeling zoned out, and that's part of the loss of control, but truly the patients describe it almost as an out-of-body experience, and that can happen during the episode or directly after. These feelings seldom last for very long, but the sort of zoned out often is followed by those feelings of shame or disgust. So there are different types of foods that are involved in binge eating episodes. People typically describe the character, so they might describe it as sweet foods, filling foods, or then they may be more likely to describe their attitude towards the foods, such as binge eating on junk foods or fattening foods. What is clear is that most binge eating episodes are composed of the foods that people are working hard to avoid. So there is no data to support that it's going to be one type of food over another. It's not more likely to be carbohydrates or fats. But what we do know really is that these episodes, when we're talking about them, it's really more about the quantity. The overall amount that's eaten is what distinguishes a binge eating episode. In general, episodes tend to be composed of around 1,000 to 2,000 calories, but over a quarter of binge eating episodes all actually have more than 2,000 calories. We also know there's a lot of different triggers to binge eating episodes. We think about sometimes there being sort of two different paths, one sort of more physiological that relates to dieting and restrictive eating, and then the other tends to be more of a psychological path. So we know that people's relationship conflict or stressors can trigger binge eating episodes. We know experiences related to shape, weight loss, attempts at weight loss, or specific foods, being exposed to specific foods or consuming specific foods like breaking dietary rules. These things can trigger binge eating episodes. We hear sometimes that boredom oftentimes precedes binge eating. And certainly, while it may not have begun this way, many people turn to binge eating as a way of managing challenges and stresses in life. One of the parts of zoning out during binge eating episodes is that there can be a brief relief or release from the reality of that moment. And so certainly it becomes a way to cope. There's a few other related eating episodes that I just wanted to define a little bit. Many people aren't familiar with the term binge eating, or they aren't using it the way therapists use the term. And so here's some of the other terms that you might hear about. When we hear compulsive overeating, oftentimes people are talking about this feeling like they cannot stop. Maybe this is actually what a therapist or a clinician might consider a binge eating episode, with that loss of control, the sort of pressure to eat, and the feeling as though you can't really choose not to. In general, overeating, and the term overeating, this is something that everyone does on occasion. Overeating is not inherently unusual. And that's probably really defined as just eating more food than you plan on eating. Sometimes people identify more with the term of emotional eating. Anybody who can identify a comfort food has engaged in emotional eating, so this is actually pretty normal. But oftentimes people associate emotional eating with some shift or change in your mood or emotions following consumption of that food. There are some people who identify themselves as food addicts or believe they have a food addiction, and the eating episodes are a representation of that. The theory behind food addiction is that there are certain types of foods that some people may have a biological susceptibility to overeating, and that the only way to prevent that overeating then would be to avoid or abstain from eating whatever that food group is. People with food addiction probably have sensitivities to certain food groups. And there is research to suggest that the brain does respond similarly to some types of, to craving foods as it does to craving other substances like drugs or alcohol. There is some contention in the field of mental health around the validity of this idea that there are food addictions. And I think part of the problem is that the term clearly implies a comparison to drugs and alcohol, right, addiction, and that the most common treatment for drugs and addiction is an abstinence model. And it's very, very difficult to abstain from eating or abstain from eating certain types of foods. And so I would say that there are some experts that disagree with the attribution of these overeating episodes being related to an addiction, and that's sort of still up for debate. And then certainly there is something we call night eating, and at certain levels of severity, night eating syndrome. When we use this term, we're usually referring to food eating episodes that are occurring after the kind of last meal of the day, so after the dinner meal. Typically that means a quarter or more of your total daily intake is eaten in the evenings. Sometimes people are actually woken out of sleep to engage in night eating, but these types of eating episodes typically don't have that loss of control. So the real distinction that I want to make here is that when you have binge eating disorder, you're engaging in regular binge eating episodes, or perhaps what you might define as compulsive overeating episodes. That loss of control component is important and required for the diagnosis. You may also be struggling with all these other types of eating episodes, and that may be causing lots of distress, but crucial to the diagnosis and to the experience of binge eating disorder is that loss of control. So let's move on to talking a little bit about who has binge eating disorder. So what we know from World Health Organization data that was collected in 2012 is that binge eating disorder really does not discriminate on any dimension. For some people, it may be a transient experience, doesn't last for very long in their lives. For other people, it may last for years. So within the United States, there have been several different estimates, but it seems as though around 2.6% of the population at any one time is struggling with this disorder. We know that the peak age of onset tends to be late 20s, but there are a couple other periods of life that are higher risk for developing binge eating. College can be a pretty high risk time. Pregnancy can also be another high risk time. And we know that while most people struggling with binge eating disorder are adults, for many people this disorder begins in childhood or adolescence. And so certainly this loss of control eating can begin at that time. We know that it affects people of both sexes. Around 4.2 million women and around 2.3 million men struggle with binge eating disorder. Compared to some of the other eating disorders, there is an even greater representation of the population who are male. I will admit that the data that we have right now reflects rather the sort of binary gender categories, and we don't really have information or data on non-binary gender categories for binge eating disorder. We know that this disorder affects all ethnic and racial backgrounds, and people from all different socioeconomic strata are struggling with binge eating disorder. So it really does not care how much money you make. Binge eating disorder is going to be present in many different types of people. So there is not one predictable category of people who are struggling with this disorder. And a point that deserves repetition is that binge eating disorder is not a disorder that you can see. It's not necessarily going to be observable or obvious to an outside person. People in all different body sizes are struggling with this disorder. And in fact, there are probably, based on the sort of American Medical Association BMI chart, there are more people at that sort of average or overweight status struggling with binge eating disorder than those at a higher BMI of 30 or greater. So we know that at their worst, binge eating disorders have many different co-occurring problems. Some of the most common psychiatric problems are anxiety, depressed mood, and alcohol or drug use disorders. We know that one of the medical comorbidities that can be associated with binge eating disorder is weight gain, and therefore the medical comorbidities listed here are those that are also associated with weight gain, such as diabetes, hypertension, heart disease, and sleep issues. We know that people suffering from binge eating disorder are frequently perfectionistic and very highly self-critical. And one of the other prominent characteristics seems to be low self-esteem, feelings of inadequacy or worthlessness. And in many cases, this is in part due to beliefs about the role of their own willpower and control, and a seeming lack of control over this binge eating behavior. So shame and guilt as primary experiences of someone with binge eating disorder really cannot be underemphasized. We know that shame oftentimes contributes to it taking a long time for people to present for help or treatment with this disorder. There may be a lot of underplaying of the seriousness and the real impact of the disorder. We know that for many people, their work and occupational functioning and their relationships are often influenced and negatively affected by their binge eating behavior. Some of the other common experiences that are important to mention are a history of pretty chaotic eating patterns. So oftentimes eating is rather delayed in the day, or eating happens at sporadic intervals throughout the day. There's usually pretty irregular meals and snacking. Oftentimes people with binge eating disorder have been struggling with this for years. The length of illness can be very, very long, again, somewhat related to the shame or lack of awareness that the label for this type of problem is binge eating disorder. And then adults with binge eating disorder often have repeated frustrating cycles of strict dieting followed by periods of binge eating. Different weight loss efforts via weight loss programs or different fad diets, they are often short-lived, and when successful, may be followed by periods of weight regain that results from the binge eating behavior. So I would say that it's important to notice that these sort of the yo-yo dieting or the weight cycling takes an enormous toll on mood and overall self-esteem. And I think tragically and too often, people struggling with this disorder do not find the treatment resources or the referrals that they need. They believe that they are overeating and that it's an issue about weight and weight loss, and they seek weight loss treatments instead of more professional eating disorder treatments. And we also know that people with binge eating disorder have often been put through the ringer of humiliation, both as children and adults. This is most common in people living in larger bodies, but people of all sized bodies report teasing, bullying, and discrimination. So we do hear that these types of experiences are often the root cycles of some of that dieting and then binge eating cycle, but also they are the root of what people will say, you know, this weight discrimination experiences will trigger a binge eating episode. So I just wanted to emphasize that, you know, at their worst, binge eating problems really do affect every aspect of life. And this disorder I cannot underemphasize the seriousness of binge eating disorder. So let's talk a little bit about how we treat it, because the great news is that we have several different treatment options. And for some people, it's going to be a combination of these treatment options that is helpful. For others, one of these treatment options might be all that they need to interrupt and end patterns of binge eating. So I'd like to start with talking a little bit about the self-help options. So when healthcare professionals or researchers talk about self-help interventions, we're referring to structured programs that were typically developed based on other treatments that are known to be effective. So one of the treatments that I'll talk a little bit more about next, but that has the most evidence-based to support the treatment of binge eating is cognitive behavioral therapy. And we have designed a cognitive behavioral self-help program, which is, I'll mention that book as a resource at the end of the presentation. But the CBT self-help program has been developed to teach individuals how to use behavioral and cognitive strategies to interrupt and overcome their eating disorders. And then that same self-help program has actually also been translated by the people who designed it into a guided self-help program, which involves some therapist support to help you continue to move through what is a difficult program, right? Like maintaining self-help programs, staying on track, that can be challenging. And so there is also a guided self-help version of that treatment. And then mindfulness interventions are also very important to mention. Mindfulness interventions may be delivered through self-help books or workbooks, and they are also often integrated into therapies for the treatment of binge eating. These may be specific meditations or integrating more mindfulness practice into your day. Mindfulness in general is a really effective intervention in helping people manage their responses to strong emotions and practice greater self-acceptance. And these two things help to support increased awareness of behavioral patterns and the existence of choice. And so when people recognize and begin to make more choices, they can interrupt some of the behaviors before engaging in them, before following through with binge eating. And then the longer term goals of any mindfulness intervention will be increased focus on internal hunger and satiety or fullness cues. Certainly that's a goal for mindfulness interventions. So let me talk a little bit about the therapy options. These would be delivered sometimes in individual therapy, sometimes in group therapy, typically by someone in the mental health field. And there are the two treatments on this slide are the ones that have the most scientific research and evidence base behind them. So cognitive behavioral therapy enhanced has been designed specifically for the treatment of bulimia and binge eating disorder and also anorexia. This treatment has shown to be very effective for binge eating. And at its core, some of the interventions include establishing a pattern of eating that is regular, so getting 3 meals and 2 to 3 snacks back into the daily routine, increasing your awareness of thoughts and moods and how those things relate to patterns of eating, and coming to recognize the different situations, some of the environmental situations or the internal situations which tend to lead to binge eating behaviors. Greater awareness about those things increases your ability to interrupt and disrupt those patterns. And then there is also attention in CBT to relapse prevention. So talking about understanding your own red flags and putting into place a plan so that when those red flags pop up again, which they probably will for everyone, feeling that you are ready to integrate the different interventions from CBT that have been really helpful to you when you went through the program. Interpersonal psychotherapy is a treatment that posits that essentially binge eating disorder develops in the context of challenging interpersonal experiences. So there is, just like in CBT, there is a focus on the way in which our sort of interpersonal reactions, our relationship beliefs are contributing to things like isolation or avoidance of certain relationships or conflict in certain relationships. And then by focusing very specifically on acknowledging and expressing emotions in different ways and improving interpersonal skills, that by default will affect and improve eating behavior and decrease binge eating behavior. And then there are 3 other treatments which have less scientific evidence, but still good scientific evidence to support their efficacy in interrupting these behaviors. I'm just going to briefly run through some of the treatments. So dialectical behavior therapy has been designed specifically to address binge eating behavior, and that behavior in particular is targeted as one where you practice different skills when you notice and have awareness about the urges to engage in that binge eating behavior. Certainly, DBT is a tool in which, we are working to learn other beneficial ways to comfort yourself, to relax, to feel more pleasure in your life day to day, and to essentially replace some of those experiences that the binge eating behavior is sort of helping you to help you function in your life. Appetite awareness training, somewhat based in cognitive behavioral therapy. It's an intervention designed to increase your eating in response to your internal hunger and fullness cues, as opposed to eating in response to the more sort of environmental cues or the mood type cues. And then acceptance and commitment therapy is a treatment that really, while it hasn't been specifically tailored to the treatment of eating disorders or binge eating, it is a treatment that certainly supports the same goals with regard to changing what you do and not necessarily how you think or what you feel. So increased awareness of your patterns of thinking and your patterns of emotion that contribute to these behaviors, and choosing to behave in ways that are more consistent with your values. And I think it's important to also mention the role of nutrition and dietitians in the treatment of binge eating. So a nutritionist or a dietitian, someone that is, they may have a degree in as an RD or an LDN, they are very important in providing nutrition and scientifically based nutrition education about food. So for those people with binge eating disorder who have spent a lifetime, sort of trying different diets, there can be a lot of diet myths out there and misinformation about nutrition and what the needs of your body are. And so dietitians play an important, crucial role in presenting the science behind what the body really needs to function well. Oftentimes, dietitians are going to also support people with binge eating disorder to troubleshoot around questions with shopping, with creating shopping lists, meal planning, and making plans around supporting that plan to have 3 meals and 2 to 3 snacks in your day. And then the longer term goal in terms of dietitians' roles is to support this model of intuitive eating. Kind of goes back to the mindfulness intervention, really increasing your awareness of your hunger and fullness and choosing to eat in response to those cues. And then there are also medication treatments for binge eating. The rationale for using medication is, threefold. We know that binge eating disorder is a mental disorder with genetic contributions, and we know that there are some neurological differences in people with binge eating disorder compared to those who do not have it. So there are going to be people for whom just the therapy interventions or just the dietitian interventions are not quite enough, and some patients need medication to meet those optimal outcomes, to interrupt the behaviors. So the medications listed here are the ones that we have the most research on in their efficacy in decreasing frequency of binge eating behavior. Within the category of antidepressants, Prozac has shown to be very effective. The epilepsy medications, Topamax is commonly prescribed. And then the FDA has actually approved Vyvanse, which is a medication you may be more commonly familiar with being prescribed for ADHD. But the FDA has approved, based on scientific evidence, the use of Vyvanse in the treatment of binge eating disorder. So these are all possibilities that you may be using or hearing or asking your prescriber about for the treatment of binge eating. So just to recap those details, we know that people of every ethnic and socioeconomic background and every body size are struggling with this disorder. We know that these specific binge eating episodes could be a reaction to dieting or to different emotional events in your life. The role of shame and guilt is significant in people who struggle with this disorder. We have a regular alphabet soup of different therapeutic treatments to address binge eating. We know that dietitian support is going to be crucial in the treatment of binge eating disorder, and there are a number of different medication options that can also be very helpful. So I just want to touch base real quick about how Walden Behavioral Care, a little bit about our company and how we address the treatment of binge eating. The Walden Behavioral Care provides specialized treatment and support at all different levels of care. So we have inpatient, residential, partial hospitalization, intensive outpatient, and outpatient treatment across 3 different states. And we provide treatment to people of all ages and all genders. And when we are treating binge eating disorder, no matter what the level of care, we have a few primary goals. We're going to work to establish that pattern of eating of 3 meals and 2 to 3 snacks a day. We are working to decrease the frequency of binge eating because any decrease is going to feel like some relief. And we are working on teaching skills to manage different emotions and how to manage different life events instead of turning to food. We have a specialized intensive outpatient program, which we offer throughout Massachusetts, Connecticut, and Georgia. It is a 3-day or night per week program, primarily group-based, but it also involves individual meetings with a staff dietitian and an eating disorder clinician. And we typically recommend a length of stay in that program of around 6 weeks. And we also provide outpatient treatment, specialized outpatient treatment for binge eating disorder, offering the individual therapy, nutrition counseling, and medication management. So now I want to just mention a few helpful books that I think can be very helpful for those struggling with binge eating disorder. The Overcoming Binge Eating text is, and any of these books can be purchased on Amazon. Overcoming Binge Eating is the book that includes the self-help program, and it is also a book that is going to be used in any guided self-help treatment or individual CBT therapy for binge eating disorder. But I find that book very helpful, actually, for people who are struggling with binge eating, and I even sometimes will recommend for loved ones and friends of people struggling. The first half of that book provides a lot of education that can be very helpful. I like the book 50 Ways to Soothe Yourself Without Food, just as a resource with 50 different skills that you can try for self-soothing when you feel urges to engage in binge eating. And then Getting Better Bite by Bite is a text that was written in collaboration between treatment providers and people struggling with binge eating. And I think it can be a very helpful resource as well. So thanks so much for your attention. I would be happy to answer any questions, or if you think of anything a little bit later, feel free to send me an email or give me a call. I'd love to sort of collaborate, support, or consult. I'm happy to be of help in any way that I can.
Thank you very much, Dr. Craigen. That was fascinating. So I have a few questions from the audience for you. One is, I think you mentioned Topamax, Prozac, and Vyvanse, and they were asking if you knew of any other new drugs on the horizon with the FDA that would be coming out in the next few years that offer any hope.
So there are, there's a number of drug companies who are working to try to get FDA approval for other medications, and in the most part, those are still not at the stage that they are ready to be rolled out. So I don't have any recommendations on that. I know that a lot of active clinical studies are in the works, and there are also medications that I did not mention that are also currently being used to treat binge eating disorder. The ones I mentioned because we have the most evidence for them, and I think that they're probably the best. If you're going to be talking to a psychiatrist or your PCP about them, those probably are the ones to focus on for now.
Sure, that makes sense. Thank you. Also, with the next question was on bariatric trends in 2018 and beyond. Is lap band still being used as frequently?
So there is a trend in most weight loss and bariatric surgery centers away from the lap band procedure. That is driven by the data on the effectiveness of that particular procedure compared to other ones. And certainly I know with regard to overlap with this presentation, we do know that some of the people who present for bariatric weight loss surgery do struggle with binge eating disorder. We do also know that many people do not struggle with binge eating disorder. So there's not a necessary overlap there, but with regard to the procedures, there is, that procedure is being done much less often, the lap band.
Interesting. And then the last question was, there's a concern about addiction for some folks that have dealt with bariatric procedures. What are your thoughts on that?
So we are really learning more and more about the presentation of substance use, which is kind of what we as therapists, we call it substance use disorders, drug and alcohol addiction that comes up for people sometimes for the first time ever in their lives after surgery. And there are, the trouble with some of this research is that we don't have a ton of research which has really long-term outcomes, so following people for more than 24 to 36 months outside of surgery. But there is some data to suggest that the way that the body responds to drugs and alcohol changes post-surgery. That may play a role in the increase in the increase in drug and alcohol addiction post-surgery. But certainly one of the things that we're really working on, and as part of my role here at Walden, is that if people are turning post-surgery to drugs and alcohol as a way to cope with life and emotions and struggles, then those are the people that probably would really benefit from some of these skills that we work on. So certainly I think that for anyone who seems to be struggling with that or noticing themselves turning to substances as a way of kind of coping or managing, those are the people who I think would really benefit from additional support from a professional to learn new coping skills.
Absolutely. Thank you, Dr. Craigen, for a great presentation. We really enjoyed it.
You're welcome. Thank you.
Bye-bye.